The top 10 things you must know about when choosing a Medicare Advantage plan. Some of you are going to watch this and go, I wish I knew that before I chose my last Medicare Advantage plan, because if I did, I would not have chosen the particular plan that I am on. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see at the end of this video. My goal is really simple. It is to help you make a wise and confident decision about all of your Medicare choices, not just some of your Medicare choices. If today is your birthday, then I wish you a very happy birthday. Dorothy Canfield Fisher said, "Those who love deeply never grow old. They may die of old age, but they die young." So let's count these down, the 10 most important things you should know when choosing or considering a Medicare Advantage plan. Number 10, Medicare Advantage is not the same as original Medicare, and it is not a secondary policy like a Medicare supplement. I can't tell you how many times people have called these 800 numbers, or some telemarketer has called them, and they have a Medicare supplement, and they get sold pie in the sky, and they enroll in a Medicare Advantage plan, and they don't realize their supplement will not work with a Medicare Advantage plan. That's very important. If you have a supplement and you are considering Medicare Advantage, understand one thing very clearly: they don't work together. Your supplement will not work. You will need to get rid of it. I'm going to give you a story, a bit of a horror story about one lady that I've shared on another video. I met with a lady, and first time I met with her, I reviewed all her Medicare. She had a drug plan. She had a Medicare supplement. I advised her to stick with the supplement that she had based on what her health conditions were, and I reviewed her drugs, and I enrolled her in a new drug plan. Following year came back around. We reviewed everything again. It made sense to switch her drug plan. Well, shortly thereafter, I noticed that she had disenrolled. And the Medicare had a rule at that time that as an agent, if somebody disenrolls, I can't call them. One of my clients, if they disenroll, I can't call them. Now I can. So what happened was she called one of those 800 number ads that she saw on TV, and they enrolled her into a Medicare Advantage plan, about the worst one she could possibly get around here. And they did not tell her that her Medicare supplement was not going to work. Finally, around June, 6 months later, she called me on the phone to tell me what had actually happened. So what I did is I told her to call Medicare, speak to a supervisor, and file a complaint against the agency that sold you that. It wasn't the insurance company's fault, because she didn't buy directly from the insurance company. She bought it from an agency. And file a complaint against them. Tell them you want your original Medicare back to January 1st. You want the drug plan that you had enrolled in reinstated effective January 1st. And then once you've got all that done, go back to all your providers, because she was getting all these bills that her supplement couldn't pay for, and tell them to resubmit to Medicare and resubmit to the supplement. And so she did that. The next time I saw her, which was almost a year and a half later, I asked how everything was going, and she was still dealing with some issues almost a year and a half later. So if you have a Medicare supplement and you are considering a Medicare Advantage plan, you need to drop the supplement when your Medicare Advantage plan starts. So after all that, Medicare Advantage is an alternative to original Medicare, and you are still in the Medicare program. Some people will lead you to believe that you're not, but you are still in the Medicare program, even with Medicare Advantage. That's why you have to keep paying your Medicare Part B premium. We take a look at the Medicare.gov when it says things to know about Medicare Advantage plans. 1, you're still in the Medicare program, and 2, you still have Medicare rights and protections. It goes on to say Medicare Advantage plans provide all of your Part A and Part B benefits, including new benefits that come from laws or Medicare policy decisions. Plans must cover all emergency and urgent care, both physical and mental, and almost all medically necessary services original Medicare covers. Medicare Advantage plan benefits exclude clinical trials and hospice services, but if you're in a Medicare Advantage plan, original Medicare will still cover your costs for hospice care and some costs for clinical care. The plan can choose not to cover the costs of services that aren't medically necessary under Medicare. It goes on to say that you have the same rights or protections as people with Medicare. So that's very important, that you have the same rights. You're in an alternative way to get your Medicare, but you have the same rights and protections as somebody in original Medicare. Number 9 thing you need to check on are other coverage rules, and I've kind of already alluded to this. So you can't have a Medicare supplement and a Medicare Advantage plan. You can't have group or retiree coverage and a Medicare Advantage plan, but you could have a group retiree plan that is a Medicare Advantage plan. So most group retiree plans are not going to work well at all as a secondary policy to Medicare Advantage plan. You may find one once in a while, but typically if you have group insurance, you want to drop your group insurance and go Medicare Advantage if that's your choice. Also, Medicare Advantage does work with TRICARE, but it is a bit tricky. My advice for people that have TRICARE, just stick with TRICARE. If you have TRICARE and original Medicare and you want to look into Medicare Advantage and you're from one of the states I'm licensed in, reach out to me. We can have a conversation about it to make sure it makes sense for you. And Medicare Advantage does work well with Medicaid. Number 8, prescription drug coverage, or what is known as Medicare Part D. So not all Medicare Advantage plans cover prescriptions, very important. And typically, unless you're in a private fee-for-service, you can't have a Medicare Advantage plan and a separate Part D plan. They cancel each other out. Not all Medicare Advantage plans offer the same drug coverage. That's why it's important. If you're on more brand names and specialty drugs, you need to make sure that you have good drug coverage each year. And all Medicare Advantage plans have the same Part D framework, meaning there's always a deductible stage. You may or may not have it, but there is a deductible stage. There's an initial coverage limit. There's a coverage gap, and then there's catastrophic coverage. Those 4 stages, all Medicare Advantage plans, all Part D plans have those 4 stages. Number 7, network. When you're on a Medicare Advantage plan, you can't just go to any provider you want and be covered. You must deal with networks, so ideally, get the largest, most flexible, stable network that you can get. And make sure your providers of choice are in the network. So when you work with me, a couple things I initially review is your medications, find the plan that's got the lowest overall drug cost, and we talk about your providers and making sure that your providers are in the network. And if somebody's not in network, you know ahead of time that doctor's not in network, which means you got to pay the full cost, or you may have to pay higher if you're on a Medicare Advantage plan. Also, make sure your state's or region's go-to teaching hospital is in the network. I can't tell you how many times this comes up. A lot of Medicare Advantage plans do not have the teaching hospitals in the network. Even though you may not access them now, you always want access to the teaching hospital. So in my case, I live in Virginia. I'm in Charlottesville, right where UVA is. And UVA is the main teaching hospital in Virginia. There's also VCU as well. But if somebody has a serious need, usually in Virginia, they're coming to UVA. And if you have a Medicare Advantage plan, you want to make sure that UVA is in the network. And that would be the case for any teaching hospital, regardless of what state you're in. Also, if you need access to a specialty hospital, like a Mayo Clinic, a Cleveland Clinic, a Johns Hopkins, whatever it may be, you want to make sure that they will accept the plan. Odds are they won't be in network, especially if it's an HMO. Now, some of them, like Cleveland Clinic, does have its own Medicare Advantage plan as well. So it just depends. Also, if you need access to a specialty hospital, and then unless the specialty hospital is a network or the Medicare Advantage plan has a passive network, my advice, get a Medicare supplement. Number 6 thing you need to know about are the out-of-pocket costs. So you need to understand your costs and understand your financial risk exposure. What are you potentially on the risk for financially when you have Medicare Advantage when it comes to co-payments and co-insurance, especially if you develop a serious health issue? All Medicare Advantage plans do have a benefit called a maximum out-of-pocket. So ideally, you want to choose the lowest maximum out-of-pocket you can get. Just because one plan has lower co-payments and extra benefits doesn't mean it will save you money in the end. So don't be sold on the extra benefits. So number 5, understand prior authorizations and benefit limits. This is very important. Prior authorizations are more prevalent in Medicare Advantage plans as compared to original Medicare. Now, original Medicare does have sometimes prior authorizations. They are not non-existent in original Medicare, but Medicare Advantage, they are more prevalent. You will likely incur them. In most cases, your provider simply takes care of it. 95% of prior authorizations are approved, and Medicare Advantage plans can limit coverage, and skilled nursing care is a big one. And you can see my video comparing customer satisfaction between Medicare Advantage and supplements for more information. So if we go back to the Medicare.gov website where it talks about Medicare Advantage plans cover all Medicare services, you notice that it says here at the bottom, the plan can choose not to cover the cost of services that aren't medically necessary under Medicare. If you're not sure whether a service is covered, check with your provider before you get service. The number 4 thing when it comes to choosing a Medicare Advantage plan is that you should never pick a Medicare Advantage plan based upon the extra benefits. All those ads that you've seen on TV for the past few years with Joe Namath and Jimmy J.J. Walker, William Shatner, and others that love to promote all the extra benefits. And the reason why a lot of people end up picking up the phone and going, yeah, I'll take it, because they get their grocery card or their dental or whatever. Well, that's usually a big mistake. So don't ever pick a Medicare Advantage plan based upon just the extra benefit. If we take a look at the Medicare and You book, it talks about the extra benefits. It says here the Medicare Advantage plans have coverage for things original Medicare doesn't cover, like fitness programs, vision, hearing, dental. Plans can choose to cover more benefits. For example, some plans may offer coverage for services like transportation, doctor visits, over-the-counter drugs that Part D doesn't cover, and services that promote your health and wellness. So the extra benefits are nice. They can save you money. They can offer convenience. But again, don't pick a Medicare Advantage plan just because of the extra benefit. And number 3, Medicare Advantage plans change every single year. They are not standardized plans. So always check your annual notice of change. So you will receive an annual notice of change in the mail sometime between late September, typically the middle of October. Make sure you get it. A lot of people just think it's junk mail and they throw it away, and then January comes and their premium went up, their co-payments went up, or something happened and they didn't realize it, and now it's too late. So always look for your annual notice of change. And what you will see in there is, here's the premium this year, here's what it will be next year. Here's the co-payments this year, here's the co-payments next year. Here's possibly some of the benefits from year to year. So you want to make sure that you review that. If you live in one of the states that I'm licensed in and you want to review your plan during the annual election period, then reach out to me between October 15th and December 7th. The sooner, the better. In addition, if you start taking more brand name or specialty medications, then check during the annual election period and make sure your plan will still be offering good prescription coverage. So number 2, don't trust the 800 numbers or the telemarketers that call you on the phone. You will likely make a big mistake. CMS is trying to crack down on these people, and many people have been misled about the Medicare Advantage plans when it comes to these 800 number ads that you see on the television. And CMS has seen a large increase in what's called rapid disenrollment of people trying to get out of them. So that's why they're trying to crack down on the ads that you see on TV. Don't be pushed into something you do not understand, which will likely be the case if you call one of those numbers or you deal with a telemarketer. Instead, deal with a professional, experienced, independent insurance agent. And the number one thing that you need to know about when choosing a Medicare Advantage plan, if you live in one of the states I'm licensed in, then please feel free to contact me. We'll seek to determine if a Medicare Advantage plan is right for you. We will review your medications, your providers, your coverage options, and summary of benefits for the plan that you choose. Medicare does require you to sign what's called a scope of appointment before I can review plan benefits with you. It is a Medicare required document. My service is free to you. The insurance companies will pay me a commission, and you can't get it cheaper by going direct. So best to get some professional advice. So I hope that was helpful. Those are the top 10 things that you need to consider when choosing a Medicare Advantage plan. If you have questions, if you need help, please reach out to me. You see my contact information there. You can go to my website. Lots of information about Medicare and retirement insurance. There's a couple contact pages on there that you can click on and fill out, and I can reach out to you. The states that I am currently licensed in: Virginia, North Carolina, South Carolina, Florida, Tennessee, and now Texas. So if you're watching from Texas and you need help in Texas, then please reach out to me. If you happen to live within an hour or so of the Charlottesville, Virginia area and you would like to meet in person, face to face, at a safe and convenient location, please let me know and we can probably work that out. Please do me a favor. Remember to like, subscribe, and who do you know that can benefit from this information? Please share it with them. I would greatly appreciate it. Thanks a lot. I'm Chris Prang, the Medicare analyst. Make it a great day.